Yes, sir.
Thank you. Hi, I would like to ask a question relating to health care, something that's kind of all near and dear to us all recently. But in my career at General Motors, I've had the same type of insurance, which has been a good insurance. 15 years ago, when we had a serious health issue, there was really little out of pocket, if any. Now, as of just recently going through some serious health care issues, the out-of-pocket costs are staggering. And I wonder, I guess, what you could or would do about our health care crisis. And just want to mention also, as far as socializing medicine, I have a brother that lives in Canada. I don't feel that's working very well either. He's having a lot of problems with it. But I'm very interested to hear what you might think you could do to help this issue.
Thank you, and I'll try to make my response brief, but you are talking about probably the most compelling long-term issue. If we'd have been having this town hall meeting 6 months ago, the dominant issue would have been health care. Now it's gas prices, and we all understand that, but health care is still the crisis out there. Very briefly, I would agree with you and your brother. My friends, we have the highest quality health care in America of any nation in the world. It's not the quality of health care, it's the cost and availability of health care. That's the problem. And again, visit this gentleman's brother in Canada or somebody in England or somewhere else in the world where they have government health care program, run health care, and I think you will find it not to your satisfaction. Every time some wealthy person gets sick, they come to the United States to get treatment. So we've got to preserve the quality of health care and bring the cost down. So it's the cost and inflation. And we've got to do a long series of things. Outcome-based treatment for people with chronic diseases. Instead of payment for every procedure, every test, every visit, then you pay them for a certain period of time and you reward them if that patient is healthy. We need medical malpractice reform. We need community health centers. We need walk-in clinics where if someone feels bad, they can go in and there's a physician and a pharmacist there. We need to have government-approved plans. In other words, there are uninsurables in America, my friends, and there are people who simply, because of the chronic diseases they have, can't get insurance under any circumstances. We're going to have the federal government make a significant contribution and the states join together and establish risk pools and get people the insurance, the health insurance. They have to have it. And could I finally mention, there's so many other aspects of this issue. But let me mention one other part of it very quickly with you, and that's wellness and fitness. Wellness and fitness, one of those alarming aspects. Statistics we've seen lately is the rise in obesity amongst young people, which leads, obviously, diabetes, high blood pressure, etc. I met a young man at the Miami Children's Hospital who had lost 97 pounds. And I said, what is it? What was it? He said, I took Shaq's challenge. Shaquille O'Neal challenged me to get in shape. My friends, I'd like to see every respected athlete in America, including the professional athletes from right here, go around to the schools and motivate young people to get well and fit. I'd like for every parent to know what the school lunch program is. I'd like for every parent to know what the physical education program is. And we have to emphasize wellness and fitness, and insurance companies should be rewarding people who hold policies for being members of health clubs, for getting regular checkups, for practicing a healthy lifestyle. And otherwise, obviously, we will never be able to reverse that. There's a whole lot of aspects of this issue. But I am confident that in a relatively short period of time, we're going to eliminate our dependence on foreign oil because I think America is on that mission. We're going to have that same kind of zeal in reforming health care in America because fewer and fewer Americans today, there's some 47 million that are without health insurance. Now, some of those did that by choice, but there are some others. There's some others that need our help, and we cannot, that's not the nature of the United States of America. Thank you. Yes, ma'am.